Well, in this week's Cardiology Countdown, we'll begin with a warning in the European Heart Journal on Celecoxib. This was a study looking at whether a COX-2 inhibitor could improve restenosis in patients undergoing drug-eluting stenting, a study done in Korea. They'd done one previously, and this was a follow-up study. In fact, showed a reduction in restenosis measured by late loss in a study of about 900 patients. However, there was a several-fold increase in the risk of cardiovascular death, or MI. It went from just 0.2% in the standard care group to 1.6% in those getting Celecoxib. So in theory, an 8-fold increase. This has been seen in the meta-analysis of Celecoxib in patients with known coronary disease, but is a fresh reminder that this agent, when thought to be relatively safe, actually has the warning that is in the FDA label of an increased risk of cardiovascular thrombotic events. At the number 2 spot is a meta-analysis overview of the new oral 10A inhibitors for the indication of DVT prevention in patients undergoing total knee or hip replacement. This was an overview that looked at 22 studies and found no difference in mortality or development of pulmonary embolism across all the studies in those getting a low molecular weight heparin-based strategy as compared with the new oral 10A inhibitor strategies. They did find, however, there were 4 per 1,000 fewer symptomatic DVTs, and not included, but many more asymptomatic DVTs prevented in the different studies. And a slight but non-significant increase in bleeding of 2 per 1,000, they estimated, increased bleeding that was a dose-related effect. And so overall, they concluded that the new oral agents are effective and a bit more effective than the traditional low molecular weight heparin-based strategies. And at the number 1 spot is a new class of drugs from the New England Journal. These are the PCSK9 antibodies, where it modulates the regulation of the LDL receptor and has been seen in this first published study to have very profound effects on LDL cholesterol. This was a study done by Regeneron and Sanofi, who are partnering on this compound, and looked initially in phase 1 studies and then a phase 2A study in just 20 patients receiving atorvastatin. And across the doses tested had a 39, 54, and 61% reduction in LDL cholesterol. This is a subcutaneous agent given every 2 weeks or 4 weeks in this study. And very early experience in just a total of 60 patients, but a major new class that has such a profound effect on lipids over and above the benefits seen with statins. And so much more to come on this, and there will be a late-breaking clinical trial at ACC of further data with this compound. So for this week's Cardiology Countdown, I'm Chris Cannon.